Hi, I'm Sandy Sufian, and I'm the PI for this poster.
And I'm Molly Pam. I'm a project team member.
So our project involved writing a cystic fibrosis, sexual and reproductive health resource guide created by CF patients, women with CF, for providers and patients. And we had two purposes. The first was to inform providers and raise awareness for patients about the intersection of cystic fibrosis and sexual reproductive health issues. And the second was to provide guidance on how to integrate and address these concerns in clinical practice. I'm going to hand it off to Molly, who's going to talk about the contents of the guide and how we created it.
So our guide contains 11 chapters, all written by teams of females with CF. The 11 chapters were voted on by a group of women on our patient task force. They include things like contraception, pregnancy, and incontinence. Each topic, we held a patient task force meeting where we had an expert come and present information on the topic. The chapter team also presented the information they had thus far created on the topic, and women got to give feedback on the chapter, then also brainstorm questions for clinic, peer-to-peer advice, and any other resources or questions they had about the topic that were not already included. So there's information on how new medications interact with contraception, how contraception interacts with CF, information like the Depo-Provera shot can decrease bone density, and people with CF are already at an increased risk of low bone density. Specific considerations, information for providers on how to provide contraception counseling, myths about contraception, including things like antibiotics make hormonal birth control less effective. That is a strongly held belief by many people. That is not true. So unique considerations, information about post-transplant individuals with CF, psychosocial implications for how the topic can interact with CF, information and questions for further research, personal stories, peer-to-peer advice, and resources, and we're excited.
So we welcome you to look at our website and look through the resource guide and enjoy. Thanks.
Thank you very much.